I'm Sarah Greven. It's a pleasure to meet you.
Hi, I'm Brooke. Nice to meet you.
I understand it's your first time to Central Maine Plastic Surgery.
Yes.
Welcome.
Thank you.
Let me start by telling you a little bit about myself. I'm a board-certified surgical physician assistant, specially trained in providing Botox and Juvederm injections. I understand you're interested in learning more about both?
Yes, I have to admit, I don't know much about either. I do know that I'd like to reduce the wrinkles and frown lines between my eyebrows. People ask me if I'm angry when I'm not, and that really bothers me.
Okay, let's start by talking about Botox. Botox is a medication typically designed to treat the fine lines and wrinkles between the eyebrows and the forehead and on the outer part of the eyes. It's an injectable medication that specifically works by temporarily paralyzing the little muscles of your face, prohibiting you from being able to make those expressions that bother you. The Juvederm is an injectable dermal filler. It's a gel medication that's injected into the treatment areas of your face, typically the areas that remain lined when your face is relaxed, as well as the areas of contour that become an issue as we age. Typically the Juvederm injections can be a bit more uncomfortable than the Botox injections, and we usually require some pre-treatment for the Juvederm using ice or a topical or local anesthetic. If you're most concerned about the lines in between your eyes, I suggest we proceed with just the Botox today.
Now, if I get the Botox today, am I going to look fake?
I get that question a lot. Most people in this area want to avoid the frozen face that a lot of the celebrities have. We're targeting very small areas of the face with the Botox injections. Therefore, we can avoid the frozen face look.
Good. Does it hurt?
It will hurt a little bit. However, we use very small needles and the injections are quite quick. Typically, any discomfort is minimal and brief. We're targeting the area between your eyes, so it's just going to be 5 small injections. Most patients are in and out of the office that day without any downtime. It is important to know, however, that there are some side effects associated with the Botox injections. The most common side effects are headache, local site tenderness, and some bruising in the area. The other more severe side effects, but quite uncommon side effects, are local site infection, a generalized flu-like symptom, as well as some eyelid drooping.
Now, what if there is a problem that happens, like eyelid drooping sounds bad? How often does that happen and how long does that last?
Eyelid drooping occurs when the Botox gets into muscles that aren't targeted with our treatment. Basically, it's really important to follow some general aftercare instructions to help prevent this. We suggest that you don't involve yourself in any heavy exercise or heavy drinking for the first 24 hours, that you avoid any restrictive headwear or tight hats for the first 24 hours, and that you remain upright for the next 4 to 5 hours. If you do have some eyelid drooping, we can support your symptoms, but really time is the only remedy. The medication needs to work its way out of your system. I've never experienced eyelid drooping in my career, but we suggest that you come back to the office if you have any questions or concerns following your treatment.
How often do you do these injections?
Injections are quite common, both Botox and Juvederm injections in this office. I found that people are quite happy with the results of their injections, as well as the subtle improvement in their appearance after the injections.
Great. Will I see the results right away?
Typically, patients can expect to see results within a week. It could be sooner, but don't get alarmed if you don't see noticeable changes in the first few days.
How long does the Botox injection last, and how often would I have to come back for the Botox injections?
Typically, Botox lasts between 3 and 4 months. A lot of patients that have been coming in for regular injections will find that they can push their appointments out a bit to every 6 months or so as the muscles that we're targeting begin to lose strength.
That's great. Now, I'm on my lunch break today. If I do go ahead with the Botox injection, am I going to look or feel weird if I go back to work?
You shouldn't look or feel weird, and you can absolutely return back to work today. I have a lot of patients that come in on a break from work during their lunch break, take time out of their day just for themselves. They find it's something nice they can do, you know. And at about $350 for the average cost of a treatment, it's more affordable than most people think.
Great. Well, thanks for answering all my questions so thoroughly today.
Do you feel ready to proceed to the Botox injection?
Certainly. Let's do it.
All right. Well, just read over this consent form, and if you have no further questions, go ahead and sign it while I prepare your Botox for you.
Thank you so much.
Great. How are you feeling? Are you ready for the injections?
I am.
All right. Well, first, I'm just going to have you make that expression that bothers you. I'm going to mark some areas on your face today, okay? Mm-hmm. Great. Go ahead and relax. And I'm just going to clean the area with a little bit of alcohol as a prep for the procedure. Good. Okay. Now just relax. You're going to feel a few injections, okay?
Okay.
Just try to relax your head back. Poke. One last injection.
Mm-hmm.
Great. All right, just hold this gauze on your forehead to minimize any chance of bruising. How do you feel?
I feel great. Felt a little sting, no worse than a booster shot. Thank you so much. Can't wait to see the results.
Good.